You are watching another video in General Practice Supervision Australia's Transition Update webinar series, Navigating Services Australia for Practice Supervisor Payments, produced by GPSA and presented by Services Australia and the Department of Health and Aged Care. We would like to begin by acknowledging the traditional custodians of the land on which this recording was produced, and pay our respects to their elders past, present, future, and their families.
Thank you everyone for coming along today. It's a great opportunity for us to get across what we need to get across to you for this transition. Also with us from Services Australia today is Lynn and Eiley. 4 steps to the organisation register. Now, the idea of this slide here is to break up what you'll see as we go through it, a fairly complicated process, but it does break up into 4 neat steps. The first of which is that you need to have set up an organisation in Proda. Now, probably most of you have already done that. Some of you won't have done that, but it is a necessary first step in making sure that you can actually access the organisation register. This is that first step broken down. And as it says there, it's the key to accessing the organisation register. And it would include setting up any subsidiary organisations for those of you who know what those are and need those as part of your organisation setup. The second step is linking that organisation to Health Professional Online Services, or HPOS. This will then unlock access to the organisation register. The third step will be the first important part of the organisation register itself, which is to set up an organisation record. And the fourth step will be to set up your site or sites with an organisation site record for each site. We'll work through each of those steps now, but if you keep in mind that 4-step breakdown of what we're about to look at, it's probably a good way of thinking about, as I said, what can be a complicated process, but thinking about it in a simple way. So the first part that we'll deal with today is that second step of linking your organisation in Proda to HPOS. There are 2 ways that this can occur, depending on whether you have previously linked your organisation to HPOS for another program, such as AIR, for example, or PIP. But the first one we'll deal with is if you haven't done this before. The way this occurs is after you have logged into Proda, you select organisations at the top of that page, and that will then take you to the next page. Also, having selected organisations, you'll see a page that lists your organisations. You may only have one, you may have more. But here you can select the one that you're going to enter into the organisation register. In this case, we've got P&O Organisation 4. Here we have an overview screen in which we pull down the menu for service provider. And we can see there with a red box around it, which is our highlight. You won't see a red box when you do this, which says Add Service Provider. When you click on that, you'll have a long list of potential service providers that you could choose, which you need to scroll down through and select Health Professional Online Services from, and then click Add Service Provider. There'll be some terms and conditions that you need to accept, and that then takes you to the end of that first pathway to linking. We'll come back to what comes next after we deal with the second pathway, which is this one, if you have previously linked for another program. So again, we're at this page where we see organisations at the top, but the difference here is that if you have previously linked, you will see this black tile on the screen that says Health Professional Online Services. Here, we need to select from those 2 boxes within that tile, link identifiers. We're presented with this screen, which invites us to act either as an individual or on behalf of an organisation. We don't want to proceed as an individual only. Now, at this point, if you don't see any organisations, you'll know that you have not set up your organisation in Proda. So the next step here is to add a new identifier. So in the previous scenario, you had never done this before, so you would be doing it for the first time, whereas now you're being prompted to add a new identifier because you had previously set up. So if you click Add New Identifier, that brings scenario 2 to the end, and the two pathways converge here, where you would then select your ABN as an identifier type. And the reason you're doing that is because that is the identifier of the organisation you're trying to enter into this register, as opposed to some other sort of identifier you previously used for a different sort of program. It will pre-populate your ABN into the box on the right based on what information you have recorded for your organisation in Proda, after which you can then click Next. You'll get this screen which verifies that the relationship between the organisation and HPOS has occurred, and you can click Next. And you will have this page then which confirms that you have access to HPOS services, and has some information there about what you can do and how you can, down there, importantly, go to My Services page in Proda by clicking here with the blue link there if you need to. But otherwise, this completes the linking of the organisation in Proda to HPOS, and you click Finish. So now you return to this screen here, where even if you didn't have it before, now you will have the black HPOS tile, and you go to Service. Again, you need to choose the organisation you're acting on behalf of, the one that you're going to put into the organisation register, but you don't want to proceed as an individual, and you select Continue. There are some terms and conditions to accept, to which you need to agree to proceed, and you'll then get this screen which allows you to put in some mail, HPOS mail settings. So this is not your ordinary mail, this is the secure HPOS mail service. You can put those in and then proceed by selecting Submit. So that brings to an end that first part of the presentation related to linking your organisation in Proda to HPOS.
So thank you for that, Paul. To Evelyn with some questions. Is there anything there that you want to highlight where you found people that you've been talking with have fallen over in the process?
For the most part, I think there's been some confusion over the different types of Proda accounts you can have. For us, we're keenly happy to support anyone through the process, both us and Services Australia. So at any stage during any of what you've heard or what you're about to hear, if you do fall over, do reach out to us. There's a transition email address that you can send something through to, and we'll respond to you, or we'll try and get assistance to you.
When I tried to do this, I too was getting stuck, and I rang Services Australia and got a wonderful person who helped me step through it. So please reach out if you are still getting stuck. My problem was the authorised person versus the contact person, and we worked out that sometimes we do have our own little idiosyncrasies in our registrations, and one size may not fit all. So please, if you still haven't been able to get through this by the end of this session and having the chance to sit down and do it quietly yourself, because they will help you and you will have success at the end.
There's a difference between what you might have in Proda, and you can see here people are talking about the owner of the organisation has to do the linking. This is different to what your expectations are. You've got the ABR crossover with Services Australia, and things don't always marry up. So Paul, did you want to speak to that as you move forward into the next section?
Yes, we can address that directly in this next section, which equates to that, one of those steps that people have been having some issues with. So this is actually where we get to the organisation register itself, which is the platform through which GP/TP payments will be administered and paid. But it's also a platform that will be reused in the future for other programs. So all of the information that you enter into the organisation register will be reused for other programs in the future. We'll come to talk about that a little bit more a bit later on. So having successfully linked your organisation in Proda with HPOS, you'll now see in HPOS a new green tile, which you wouldn't have had before, that says Organisation Register. Some people don't see that tile after they have successfully linked. And it would seem that there are some cases where people's browser cache is full, so their browsing history is filled up, and they need to clear that browsing history, after which the tile will appear. That seems to be a relatively common problem, and a quick fix for that, if it doesn't appear after you have been told it has successfully linked, is that your browser cache may be full. If you're looking for it and don't see it and have done that, you may not be able to see it because you don't have the right attributes in Proda that will allow you to see it. And the only way that could happen is if someone else other than you who did have those attributes, have that access, had done the first part of the process of linking the organisation in Proda to a. But if we click on Organisation Register, we now go to the next screen. This is the first screen that you will see. You'll see that some details have been pre-populated here from your ABN, and that there are 4 tabs running horizontally across the page: Organisation, Contact, Key Individuals, and Associated Sites. And down the bottom, a section that says Add Ultimate Organisation. We'll deal with that part first. So an ultimate organisation is a recognised legal entity that the business considers to be the one that has hierarchical control over what they're registering in this organisation register. This isn't a mandatory part of the process, and it's a question for individual businesses to decide whether they want to do it or not. And to do it, you select Add Ultimate Organisation, which you can see in the red box at the bottom. And you'll see a screen with a pop-up like this, where you can add the ABN that you wish to create the ultimate organisation for and select Confirm. You then see this screen where you can verify the details you've entered down the bottom, and then select Submit underneath that. You'll have a summary screen there, and if everything you've entered is correct, you select Save. That then brings us to the part of the organisation record that most of you will be dealing with, and many of you probably already have. And the first tab there is Organisation on the left. You can see that all of the information from the ABN has already been populated there, and you don't need to do anything with it. So if you move then on to the next tab, which says Contact, you'll get this where you need to enter one phone number and an email address and a postal address. This particular addressing format is quite complicated, and it's the way it is to accommodate various types of addressing that may not be as simple as a street number, a street name, and suburb and postcode. The easiest way to fill this in is to actually start at the bottom with the postcode, which will then start to pre-populate some localities for you, and so on with the streets and the street numbers. And remember that, because that will apply later on when we need to add addresses in other parts of this process. So after you're happy with what you've entered, you click Submit, and it moves us on to this next tab, Key Individuals, which is where that issue we were talking about a minute ago about who you enter in as the associate or the authorised contact becomes very important. This section of the process complete, you need to add an associate and an authorised contact. The associate needs to be who is listed in the Australian Business Register for that ABN. They don't necessarily need to be listed on the ABR as an associate, because some organisations, such as sole traders or government organisations or some trusts, don't actually list a person as an associate. But you need here, when you're adding a key individual, when you click that key individual box, this pop-up will occur. You need to add as I said earlier, at least one associate. Importantly here, while the associate can have a PROTA-RA number or a STEM number, they don't need to. And there may be the case that there is a director of an organisation who doesn't have one of those numbers. And so you can select no ID on that drop-down box that you can see there, where PROTA-RA number is highlighted. Underneath that, it says no ID. You can select no ID and then not put an ID number in. And the reason that works is that this is where the system is checking the Australian Business Register for that person's details as a way of verifying that this is verifying the bona fides of what is occurring. So you need to put in first name, if there is one. It doesn't have an asterisk next to it. And the reason it doesn't is that we're saying, I guess, that only one name is required if all you have is one name. And so surname has an asterisk next to it. But if you have a first name, you need to put it in as well, because it's going to check that against the ABR.
Explain for us, please, what the STEM number is.
Sure. Eiley, would you like to talk to that?
Associate would have a STEM number if they're also a health professional. So it's essentially the first 6 digits of their Medicare provider location number. So if it's a smaller practice and a sole trader, and so this associate happens to also be the principal GP that works at that practice, they would likely have the Medicare STEM, and it would be that first 6 digits. Otherwise, as Paul mentions and as it has on the slide, you can use the PROTA individual RA number or select no ID if the person you're trying to add as an associate has not interacted with Services Australia before.
We've been asked here, what would you use as an example for ultimate organisation?
So as Paul said, it's entirely up to your organisation, your business, to determine whether or not you want to provide that information. An example that may come up is where your practice is owned by an organisation that's part of a broader corporation. So an example that we look up and have done our research on is some of the IPN clinics and Sonic Healthcare and so forth. And it's essentially just a way for us to understand your business structure, but it's completely optional and voluntary and doesn't have an impact as to whether you can participate in the GPTV program or not.
So Eiley, just to continue on from that, so you've got Marcus here who says he's got 40 subsidiary organisations. Do they need to go through the process individually?
So that depends if you would like each of your subsidiary organisations to only manage one site. So I'm assuming that the 40 subsidiary organisations relate to 40 different practice sites. So if you want, a practice record on the organisation register to only be accessible by each of those subsidiary organisations, then you'll need to register those 40 sites on the org register and then connect it through the subsidiary organisations. If you're just trying to get them onto the org register for the first time, you can actually do it all through a PROTA parent organisation. So you can use the top level PROTA organisation account, go into the org register through the green tile as Paul's showing you, create all of your sites through that one account at the top using the PROTA parent organisation. And then if you do want to restrict each of those organisations' site records to the subsidiary organisations, then there'll be another linking process for that as well. It is quite complicated, and we know that there is a lot to do when you've got 40 sites. So feel free to reach out to us after this and we can probably provide you with more support.
I guess, though, that would be where you're actually providing training under the AGPT. So you wouldn't assume that all 40 sites would individually be supporting a registrar, potentially. So thank you for that. Sorry, Paul, I just wanted to clarify some of those questions along the way. It is a bit confusing and it is very difficult with the different, as I say, the different perspectives people are coming in at it from. So thank you.
Yeah, no, absolutely. We'll come to some of that a bit later, I guess, and it'll become hopefully a little clearer how individual practices are brought into this in the next part of the presentation. But there'll still be some, particularly about subsidiary organisations, I guess, which we would probably be best answered in writing later, I'd say, because it is a little bit complex. But staying on this screen just for a little longer, this is quite significant, this particular part, because it's absolutely necessary that someone is entered as an associate for the process to proceed. And because the system checks this information against the Australian Business Register, that needs to appear in the same way there as it does when you enter it here. So, for example, if your name appears differently in the ABR to what you enter here, then you will get an error. So it's worth checking exactly what appears in the ABR before you do this if you have some doubt about the way that might appear. So, for example, if you're a Kate in one place and a Catherine in another, or you have a surname that has two parts to it, but in one of those places you're only using one part of it. That sort of thing where a name can appear differently. But there are also things we can help you with if you get stuck. So the second type of key individual you need to enter is an authorised contact, which is the person that I guess you would like to be the person Services Australia would contact if there was an issue to do with the organisation register that the practice needed contact with or help with. This person's details are not checked against the ABR, but you do need to put an ID type in there. And there is, again, ProtoRA number, and there's a couple of other options in there as well. Even though there isn't an asterisk, you need to provide at least one phone number and a first name. After you've done that, you'll see a screen which shows you what you've entered and you can submit. You'll get a summary screen of everything you've done to this point, including with some prompts if you've left things out, but you can check over what you've entered to make sure it's correct or address those prompts where you may have forgotten to some information, which you'll need to go back to and complete. If and when it's complete, you can then select Save at the bottom of the screen. After you've done that, you'll see the status near the top of the screen will change to active. So what that means is you now have an active organisation record, which will take you to the next part of the process when you click on the last tab in this section, Associated Sites. That is the end of that first part of creating your record in the organisation register.
I have noticed one or two questions around the cut-off date or the need for quick registration. Some of you may have received a call from the department. Some of you may have received an email from the department. We're currently tackling through those practices who have a registrar commencing with them in semester 1, 2023. That's the first priority. We need to provide practice payments or supervisor payments to you. So they're the ones who we need to get on as soon as possible. For those of you who don't have a registrar lined up for semester 1, 2023, there is the ability to actually register. There's a couple of things. I think the org register will be used for a number of other programs, so it isn't just putting all your eggs in this one basket. Depending on what else we fund out of health GP training, there's the possibility of using this payment system for that too. So what I will say is that registering on this system means that there's no need to do that invoicing and all the other bits and pieces that you may have had to do with the RTOs. The colleges look at the training data and they automate a payment through Services Australia. So a tiny bit of pain initially, and then you only need to go in if something changes, if some detail around your organisation changes.
So the next part of this process is what was step 4 on that slide I showed at the beginning, which you may recall, and that is setting up the last part of the organisation register, which is the organisation site record. Someone asked, what is an associated site? Well, after you click on that button in the previous part, Associated Sites, you will see and click Add Site. You will see this screen where there will be a fair bit of pre-populated information, but you will be invited to fill in the organisation site name, which you can see here in a red box that we have P&O Organisation 4 as an example. Now, the reason for doing this part of the process separately from that last one that you just did is because many organisations will have more than one site at which they operate. So the first part was the, if you like, the parent organisation record, and now the associated sites are the places at which that business operates, including if you only have one place at which you operate. You can see there are a number of tabs running left to right across the screen, the last one being banking details, which we will come to last. So after putting in your organisation site name and clicking submit, we'll then go to the next screen. Again, we have an address to put in, same as before. If you start with the postcode first, it will then auto-complete our locality and then street and so on. And that is the easiest way to do this. So the next screen is the Services tab. Here, you will be able to enter the type of service and the service delivery types that are operated at that practice. So you see here in the red box, we have selected General Practice Service as the service type. And after that, we can click Confirm. And then the next part, which is service delivery types. And there are some options there. We have selected, in this example, services at site location, which means the services are provided at that site location, because there are some types of practice or site that might actually operate their services somewhere else, such as mobile services. Click Submit here, next screen. And we move along then to a Contact tab, where again there is a phone number and email required. This may seem repetitive, but if you have more than one site, it may well be different. For the postal address, the second part of this screen, the same applies with filling that in. If you start with the postcode, it works a lot more easily. But there is also a tick box there for you to tick if it is the same as the physical address, and it will auto-complete it for you. After which you can click Submit. We then come to key individuals again. Again, this may seem repetitive, but if you have more than one site, you may wish there to be an authorised contact who is different for each of those sites. So we click Add Key Individual, and this familiar pop-up occurs. There is no associate here, only an authorised contact. And the way it's filled in is the same as previously for the organisation record, which was that step that we did before this one. So we enter that information again. We need a phone number there, a mobile or a landline, and click Confirm. So that then shows you what you've just entered, and you can submit that. You see this familiar summary screen, which allows you to check what you've put in or respond to prompts if any information has been left out, which you can go back and fill in, after which you can save. Now you'll see near the top that the status of the organisation site record is active. The next tab along is accreditation. For the purposes of general practice training payments, you don't need to complete this tab. It, however, wouldn't be a wasted effort if you did, because, as we said earlier, this platform will be used for other programs in the future where that accreditation may be useful. And this is how you would complete that accreditation, by pulling down that menu there next to where it says, is the organisation site accredited or exempt? So if you selected accredited, you would then be able to select from a pull-down menu of types. In this case, we've selected RACGP General Practice, and then we would submit. But you may also wish to select that you are exempt, where it says, is the organisation site accredited or exempt? And then in the type pull-down menu, there's some options there, which is working towards accreditation, for which there are then some start and end dates. But there would be other options that you can pull down from that menu as well. And you click Submit. The summary screen, which allows you to check and go back and fill in anything you may have missed, and then click Save at the bottom. You'll then get a message indicating that the organisation site has saved successfully, and we can move on to the next tab, which is Provider. Again, for providers, you don't need to add them for the purposes of GPTP, but you can if you want. And we'll just briefly go through the process of doing that by clicking Add Provider. It'll prompt you to put a provider number in and find it. You'll get this screen, which requires you to agree to a declaration and confirm. And then you'll see that provider entered there on this next screen. And you can enter multiple providers by the same process. Same thing again. And there they are. And you can now click Submit at the bottom, after which we see the now very familiar summary screen and can click Save at the bottom. Now we come to the business end of the presentation. This is where we're at the moment. And the next tab that you do need to complete for GPTP is the Program Registration tab. Here, there is an option to select a new program. The only thing that will appear there at the moment is GPTP, which you select and then select Add Program. The summary screen appears, select Save, and we come to banking details. You'll see after you click on the Banking Details tab that the program you previously selected, GPTP, is there. And over on the right, under the Action heading, you have the opportunity to add. So if you click Add, which then allows you to add banking details. Now, in this example, you'll see that Select an Existing Account has been selected. At the moment, the reason we put that in there is just to emphasize that you will not be able to select an existing account at the moment because you'll be entering it for the first time. When this platform is used for other programs and you have your GPTP banking details in here, you'll be able to use this option and then reuse those banking details for future programs. So what we will need to do for GPTP is enter a new account, and this will be as simple as entering your BSB, the name of the bank, the branch where the account is held, the account number and the account name, and then completing the declaration at the bottom and clicking Confirm, and that brings the process to an end. Note the web address here. This site has a wealth of health professional education materials in it, including, under the HPOS heading, a range of e-learning modules and infographics that deal specifically with the organisation register. Over to you, Carla.
Thank you so much, Paul. Well, we've got that address up there, so that takes us through to all the different options on the site. Can you talk us through which of those are the points that we should be looking, because that's everything, like that goes through the aged care provider portal, it takes you into a generic page. Could you maybe streamline this for people so we know how to use it?
Once you've got into that website, there are a number of tiles that appear, and because the organisation register sits under HPOS, if you then on this website click on HPOS, it will then take you to a number of HPOS tiles, one of which is the organisation register. And going back to what we discussed at the very beginning, which was step one, which was having an organisation in PRODA, there's material on this website about how you set that up if you haven't previously set one up, but that comes under the heading of PRODA because that is a PRODA matter, not an HPOS matter.
So this is what you get into when you hit that link. So you're taking it through to HPOS, to the organisation register, and there you've got your actual e-learning series that have been created with the infographics to help step us all through.
Just might be worth adding there, Carla, that those e-learning modules actually contain all of the screens that we've just been through as well with commentary.
Fantastic. Is it only the business owner that's able to register for the organisation record?
It depends on what attributes a person has been given by a business owner. So a business owner may, in PRODA, give someone else in their organisation the necessary access to set up the organisation register. The attributes they need to do that appeared on one of those slides early in the piece, which are HPOS org admin and HPOS org site admin, which will be automatically allocated to someone if they have owner access as well. There's a third attribute that is necessary, though, for completing the banking details, and that is HPOS Finance.
Going back to Paul's original points as to who can go through this process, essentially, once the PRODA organisation has been created, which would need to be done by someone that's connected to the ABR, and as Paul said, that's a another matter in the produce space. But once it's up and running, if the business owner delegates to you those attributes, that will determine what you're able to do. If you're working on the organisation record, so the data that was associated with the ABN, you would need the HPOS org admin. If you only want someone in your organisation to be able to manage the site record, so the second or the third part of the process that Paul had showed us, then that would be HPOS org site admin. And then to add the banking details, you would also need the HPOS org finance attribute. I think we do have a module, Paul, that outlines the attributes and what ones you need for what purposes. So
indeed, they're all in that HPE material. Yeah.
Terrific. So Gina pointed out that for her, the banking tab does not have the add option. Is that an indication that something else hasn't been linked, like something hasn't been completed earlier in the process? Can you get through to the banking screen without having all of those options come up?
That's probably because that HPOS org finance attribute is delegated.
Yes, that's correct. If you don't have the correct attributes, which will need to be given to you in Proda, you'll get a message that says you don't have the right permissions to add the banking details. So if that's the case, then you'll need to talk to someone within the Proda organisation, ideally the director, but I know that some of those people are on leave at the moment, to review your accesses and make sure that you have that either HPOS org admin and the org finance attribute to be able to provide that information.
A lot of people are worried about the timing, like deadlines on this, and I think I'll throw that to you because it brings in the whole of the transition thing. Evelyn.
Yes, as Carla's mentioned, there's quite a few questions around the deadline. The payment system officially starts on the 1st of Feb, so that's when the system can start making payments, but we are working through still the ability to trial a few payments the week before, so from the 21st possibly. So our deadline would be the 21st. Let's try and get everyone on there by then. Once you are registered, if you don't quite make it all the way, and you might think you've made it all the way, but you don't, the system has a neat little thing where it actually will tell you we've tried to make a payment, but we've been unable to because your banking details aren't correct or there are no banking details in there. And it'll send you through the HPOS email, it'll send you a little reminder every 7 days for 2 months. So there is the possibility of that to keep reminding you to go, but we are looking for 21st of January as our cutoff date. I also note some questions around accreditation. I know that for the bulk of you, you've been accredited by your RTO, and in college-led training, all practices that are currently accredited will be able to be grandfathered in by both colleges, so you'll continue to be accredited. I have a feeling that the tab that we have on the organisation register won't align with what is currently RTO-based accreditation processes. By all means, feel free to skip that one because it isn't required to make these payments to you. So it's something you can go back and...
More a second semester kind of issue. So let's pretend that tab doesn't exist for semester one. I'll just go back to that point. Deadline is actually more from your side. What we've been told up until now is if you don't have this all sorted out by Feb 1st, don't panic because you're not going to miss out on the payments. It just means there might be a lag while you catch up.
Yeah, exactly. So the colleges have a whole lot of training data which they'll use to make these payments. If you don't get on, by all means, don't panic. And I know my friends at Services Australia will do their best to sort through all your queries in January, but don't panic because the payment is based on that training placement that you have, and there's the ability to make that payment at any stage. So if you're not on, the colleges are able to provide that payment to you later down the track. Hopefully not too late, but by all means, don't panic. There is the ability to make those payments past the 1st of Feb.
If I can just point out, in talking about the colleges component of this, the colleges will actually have to authorise that the training is happening, so not just any old practice can sign up to this system and get money. So that organisation site ID, record it somewhere, stick it on your keyboard, whatever you've got to do, because that's actually what you're going to have to refer on to the colleges when they've got their documentation ready for you to roll. That is the missing link, that if everybody can please take note of that, organisation site ID number, as that will be required to make the money happen.
You beat me to it, Carla.
I just thought I would, Paul. Thank you very much, Paul. Thank you, everybody from Services Australia and Evelyn. Your time is always very valuable to us.
Thank you, everyone.
Thanks for watching. We'd love your feedback. Please comment or subscribe to our YouTube channel for updates on new videos. If you'd like to ask a question or suggest a topic, you can contact us via our website at gpsa.org.au. GP Supervision Australia is supported by funding from the Australian Government under the Australian General Practice Training Program.